I'm Joe Augustinelli, Social Media Manager at Greenway Health, and this is Putting Possibility into Practice, the podcast from Greenway Health. And today I am joined by Dr. Lori Teverbaugh, an OBGYN physician in Peoria, Illinois. Teverbaugh Croland and Mueller OBGYN and Associates is devoted to the care of females of all ages and finding the best solution to their healthcare needs. It is a large practice with 5 OBGYN physicians, 6 certified nurse midwives, and 4 nurse practitioners. Despite its size, it prides itself on personalized, individualized care and strong communication with its patients. And Dr. Teverbaugh, I thank you for joining me today. And let's start off with some background information for our listeners. Tell us a little bit about yourself and your practice.
Well, like you said, my name is Lori Teverbaugh. I'm originally from a small farm town, Watseka, Illinois. Came from a very traditional family and became quickly a University of Illinois inbred. I did my undergrad at U of I in Champaign, my med school in Peoria, and did my residency in Peoria also through OSF and the University of Illinois. I quickly became sought after by many of the OB-GYNs there, and I decided to join a single group at that time with only one other obstetrician. And we developed, after several years of being together, we added physicians, we expanded offices, we had 4 offices, and we now consolidated those 4 offices into one giant office about 2 years ago. And we're able to offer many services now.
And how does such a big practice provide individualized personal care for its patients like you guys do?
I feel that the software company that we are through, Greenway, gives us that ability. For example, if we're out in the field, meaning out at the hospital doing surgeries, doing deliveries, having to communicate with our insurance companies, communicate with other physicians or referral services, we are able to do that very efficiently and get them accurate information. The other point is that we offer such diversity. We have providers that are from all walks of life. Some of us went straight through school, some of us didn't, some of us had other professions before we became, the providers that we are today. I think there's a place for everyone in our practice, because if you can't find it in a practice of our diversity, I'm not sure where you'd find it.
And I mentioned it on the intro a little bit, but you pride yourself on the communication. And during your career, how have you seen patient engagement and the importance of providing a great patient experience evolve?
The patients really appreciate the way that we can take them through the flow of the office, meaning from front to the provider experience to them exiting the practice. Our management systems, our ability to give them, the visualization of maybe, for example, a surgery that we're doing or an image that we've created in the office. They can see that through our systems, and we're able to teach them in a better manner, about what they're up against for their upcoming surgeries or care, as well as, bringing their other family members into the loop so that they can actually see, what we're talking about, as well as talk to the physician or provider themselves.
And in your partnership with Greenway Health, how has the use of the patient portal benefited the physician-patient relationship?
The patient portal has been wonderful because we have expanded, and we're hopefully going to expand more with the amenities that Greenway has to offer. At this point, we have a system in place where we can communicate with the patients about appointments, as well as lab work or images, again, that have been created, or just communications overall that we need to get to them. Or they may contact us and say, can you please forward this information to one of the other physicians or hospitals in the community? And we can readily pull that up with ease and complete that for them.
seem to have a pretty good handle on communication and education with your patients. So what advice would you give other large practices who may be struggling with communication and education for their patient base?
I would give them the advice. We have been with the Greenway system. It's been many other companies prior to this since 2007. So we've had opportunities to look at other software systems and have not found anything that is as user-friendly and comparable. So it allows us, especially as the physicians of the practice, to communicate with our, mid-level providers and make sure that there's not anything that gets missed with a patient, and we're able to do that efficiently. I would say to anybody that if they're going to look at a system that is forever, improving and expanding, this would probably be the one. We've done our footwork.
Great. I want to thank Dr. Lori Teverbaugh, my guest on this episode of Putting Possibility into Practice, for joining me today. You can follow them on Facebook at OBGYN of Peoria. That's Peoria, and also on Twitter at the Twitter handle ASSOCTEVERBAUGH. And once again, I thank Dr. Lori Teverbaugh, an OBGYN physician in Peoria, Illinois, for taking time out of her day to join me for this episode of Putting Possibility into Practice. And for more on the product solutions that Greenway Health offers, you can visit our website at www.greenwayhealth.com. I also invite you to subscribe to this podcast either on SoundCloud or now on Google Play and on the Apple iTunes Store. I'm Joe Augustinelli, the social media manager at Greenway Health, and this has been Putting Possibility into Practice.